medical-style monograph from Marvelon, desogestrel ethinylestradiol. This is educational information only and not a substitute for medical advice. NASH Marvelon Comprehensive Drug Monograph. 1. Generic name, drug class, brand name, drug forms. Generic name, desogestrel 150 milligrams, ethinylestradiol 30 milligrams. Drug class, combined oral contraceptive, COC, pharmacologic classes, progestin, third generation, desogestrel active metabolite ethinylestradiol, estrogen, synthetic estrogen, ethinylestradiol. Brand names, Marvelon main brand, others, Mercilon, lower estrogen dose, Regulon, etc. Available forms, oral tablets, usually 21 active tablets per blister, standard dose 30 micrograms EE plus 150 milligrams desogestrel. Definition: Marvelon is a combined estrogen-progestin oral contraceptive used primarily for the prevention of pregnancy. It uses low-dose hormones to inhibit ovulation, thicken cervical mucus, and modify the uterine lining, making conception unlikely. It is a third-generation contraceptive known for improved cycle control and lower androgenic effects. Number 3. Mechanism of action. Detailed. Marvelon's contraceptive effects are achieved by multi-level inhibition of the reproductive cycle. Part 1. Ovulation suppression, primary mechanism. Desogestrel, ethinylestradiol, inhibits the luteinizing hormone LH surge needed for ovulation. Ethinylestradiol helps stabilize the endometrium and enhances suppression of follicle-stimulating hormone FSH. Part 2. Cervical mucus thickening. Progestin thickens cervical mucus, sperm penetration becomes difficult. 3. Endometrial alteration. Estrogen plus progestin create a thin, less receptive endometrium, reduces chance of implantation. 4. Tubal motility effects. Slows tubal transport of sperm and ovum, additional contraceptive effect. Overall contraceptive efficacy, 99% with perfect use. Number 4. Pharmacokinetics, highly detailed. Ethinylestradiol, absorption rapid, well absorbed orally. Bioavailability 40 to 50% due to first-pass metabolism. Peak concentration 1 to 2 hours post-dose. Distribution highly protein-bound, 98%, mainly to albumin. Metabolism, hepatic via CY3A4, conjugation, sulfate glucuronide. Half-life 24 hours. Excretion, urine 40%, feces 60%. Desogestrel, absorption, rapid, converted in gut wall and liver. Active metabolite, ethinylestradiol. Bioavailability 60 to 80%. Peak concentration 1.5 hours, desogestrel, 2 hours ethinylestradiol. Distribution binds to SHBG, sex hormone binding globulin, and albumin. Metabolism, hepatic, CY3A4. Half-life, desogestrel 5 to 7 hours, ethinylestradiol 30 hours. Excretion, urine and feces. Number 5, uses therapeutic benefits. Primary use, contraception, prevention of pregnancy. Secondary, non-contraceptive benefits, cycle regulation, reduction in menstrual bleeding volume, decreased dysmenorrhea, painful periods, reduced premenstrual symptoms, reduced risk of ovarian cysts, endometrial cancer, ovarian cancer, improvement in acne due to low androgenic progestin. Number 6, indications, contraception in women seeking an oral hormonal method, treatment management of irregular menstrual cycles, heavy menstrual bleeding, functional menorrhagia, acne off-label in some regions, premenstrual syndrome, PMS. Number 7, contraindications, detailed. Absolute contraindications: do not use Marvelon if the patient has cardiovascular, venous thromboembolism, DVT, PE, arterial thrombosis, or history of stroke, heart attack, angina, known thrombophilia, e.g. factor V Leiden, migraine with aura, estrogen increases stroke risk, liver-related, severe liver disease, hepatic tumors, benign or malignant, impaired hepatic function, hormone-dependent tumors, known or suspected breast cancer, estrogen, or progestin-sensitive malignancies, pregnancy, confirmed or suspected pregnancy, other, unexplained vaginal bleeding, hypersensitivity to any component. Number 8, precautions before taking Marvelon. Discuss with a clinician if the patient has family history of clotting disorders, smoking, especially age 35, obesity, BMI 30, diabetes, with or without vascular complications, hypertension, controlled or uncontrolled, hyperlipidemia, depression or mood disorders, gallbladder disease can worsen, lactation may reduce milk supply, upcoming major surgery or immobilization, systemic lupus erythematosus, Crohn's or ulcerative colitis, migraine without aura, history of cholestatic jaundice. Number 9, how to use Marvelon instructions, standard regimen, 21 days on, 7 days off. Take 1 tablet daily at the same time. Starting the pill. 1. Day 1 start preferred. Start on day 1 of menstruation, immediate contraceptive protection. 2. Sunday start. Start on the Sunday after your period begins. Use backup contraception for 7 days. 3. Quick start. Start immediately. Use backup for 7 days. If vomiting, diarrhea occurs, if within 3 to 4 hours of taking a pill, take another pill. Number 10. Dosing information. 1 tablet daily. 30 milligrams ethinylestradiol. 150 milligrams desogestrel. Fixed daily dose. 21 active pills. 7 pill-free days. Number 11. Missed dose and overdose. Missed dose guidelines detailed. If 1 pill missed to 24 hours late, take immediately. Continue schedule. Protection maintained. If 2+ pills missed 48 hours late, week 1, take most recent missed pill ASAP. Continue pack. Use backup for 7 days. If unprotected sex occurred, consider emergency contraception. Week 2, same as week 1. No need to skip pill-free interval unless many pills missed. Week 3, take most recent missed pill. Skip pill-free week and start a new pack. Overdose symptoms, nausea, vomiting, vaginal bleeding, breast tenderness. Treatment supportive. No specific antidote. Number 12. When to stop? Avoid continuing Marvelon. Seek urgent medical help and discontinue if any of these occur. Signs of blood clots, leg pain or swelling, sudden chest pain, shortness of breath, coughing blood, signs of stroke, severe headache, visual changes, weakness on one side, liver issues, severe abdominal pain, yellowing of skin, eyes. Other reasons to stop: pregnancy, onset of migraine with aura, marked hypertension. Number 13. Side effects, common, usually mild. Nausea, headache, breast tenderness, breakthrough bleeding or spotting, mood changes, fluid retention, acne changes, lower libido in some. Less common, weight change, migraine without aura, vaginal discharge changes. Serious, rare but urgent, DVT, PE, stroke, heart attack, severe hypertension, liver dysfunction, gallbladder disease. Number 14. Vital information, key safety points. Does not prevent STIs. Smoking plus estrogen significantly increases clot risk. Be consistent. Take pills same time daily. Vomiting, diarrhea affects absorption. Some medications reduce effectiveness. Regular BP monitoring recommended. Number 15. Drug interactions. Drugs that lower Marvelon's effectiveness, enzyme inducers. Rifampicin, rifabutin, carbamazepine, phenytoin, topiramate, phenobarbital, certain antiretrovirals, St. John's wort, Marvelon may affect, warfarin, change in anticoagulation, corticosteroids, increased effect. Thyroid medications affects thyroid binding globulin. Lamotrigine lowers lamotrigine levels, risk of seizures. Thank you. Have a nice day.